So what's up, everybody? Cam here, stupid cover band singer, also lead singer of the world famous Velcro Pygmies. And we are thrilled that you have chosen to join us tonight. Those of you that may be new to what I'm doing here, let me kind of explain it to you. I call the show Outside My Lane, and that was sort of an inspiration because I get kind of opinionated, and I get on Facebook Lives and I talk about a lot of things, and that upsets certain individuals. And oftentimes I'm told that I need to just stay inside my lane. I don't need to talk about things that I don't know anything about. I need to stay inside my lane. And so that inspired me. And I thought, well, why not use this platform as an opportunity for other people to come on and to educate us on their perspective and their point of view and their firsthand experiences. So, few rules of the road here, just so that everyone understands. What we're going to be discussing tonight is very politically electrified right now. We're going to be talking more concerning the COVID-19, the virus, the response to it, the treatments, all of those type things. And this show's purpose is not to debate. This show's purpose is to give a voice to individuals who have a firsthand awareness of things that are going on. So this is their perspective. This is their objectivity. One of the things that I try to explain to people is that objectivity is very subjective. I know that's a weird thing and a weird concept, but your objectivity is not pure. Your objectivity is based on your life experience. It's based on your job. It is based on your environment. So the way you view something could be completely different from the way I view something. And that doesn't make you right and me wrong, or me right and you wrong. So the two wonderful young ladies that we're going to be discussing with tonight have their own objectivity. And we are really, really looking forward to you meeting them and getting to kind of hear what their experience is. So up first, I'm going to introduce them one at a time and let them kind of tell you guys a little bit about themselves. Also, please be sure to like and share. Let's get as many folks in here watching as possible. Let's get the fireworks going. So up first is Gina Robertson. And so we're going to bring Gina on camera here. Hello, Gina. How are you tonight?
Hi, I'm doing good. How are you?
Wonderful, wonderful. Now, Gina, you are a registered nurse, and you are currently with the Tanner Medical Health System, correct?
Correct.
Also, Gina is also a small business owner here in Villa Rica. So tell everybody a little bit about your small business that you have here, which is also affected by this situation.
It is. I own Sprinkles Donuts and Coffee in Villa Rica. We're just a little donut shop.
And how long have you guys been there?
4 years.
4 years. And then as far as being a nurse, that was not your first choice, right? What was your original career path plan?
Oh, when I was young, I wanted to be a doctor, but that didn't. I wanted to deliver babies, actually, specifically. But I was a stay-at-home mom and put my husband through college, and then we'd been married 20 years when we ended up getting a divorce, and I was in a situation where I didn't support myself. Well, not the way that a family's used to at that point. And I had 3 children. So I went back to school to become a nurse.
And you went to West Georgia, correct?
Well, I started at West Georgia Tech and got my RN, and then I went through the bridge program at West Georgia.
Now, and what is your photography passion? There's a photography thing going on there, right?
Well, I did photography for many, many years, and actually, when I was deciding what to do after the divorce, I was going to go to art school for photography, and I just kind of weighed the two things and how could I do it debt free, and obviously, SCAD's very expensive, and there's no security in that, so I took the nursing path.
So your choice to nursing was somewhat financially motivated.
And passionately.
Okay.
It was both. It was
okay.
both.
Okay. Wonderful.
I love nursing.
And now, and so how long were you a nurse before you did the sprinkles thing? How long? What was the?
Um, well, I've been a nurse for 7 years, and Sprinkles is 4 years old. So,
So it's they're kind of different, and so you kind of get a little taste of both things, right?
well, my parents owned a donut shop for 20 years before that.
Okay,
So I
okay,
already had my foot, that was already a family business.
I got you. Wonderful. All right, so everyone has met Gina, and now we are going to bring. This is Joy Horton, as she pointed out. It's like Horton hears a who, so her name is basically like Dr. Seuss. That's what she told me. And now, Joy,
That's right.
if I'm not mistaken, you have a nursing was your second choice, correct?
Yes. Yeah.
And tell us a little bit about your pathway to becoming a nurse.
Well, I got my first degree in art, which, just like Gina said, that wasn't the most financial, option that would, bring in a lot of finances. So I didn't want to, I wanted to make money. And I had a son that ended up being in the NICU for a long time. And that just kind of sparked an interest in nursing and what they do. And I loved what they did. So I decided, why not? Life's too short. So I went to nursing school um, and now I've been doing it for about 8 years.
So you went to UAB, correct?
Yeah, yes, I went to UAB and I went to, yeah.
Because there's a lot of people that are going to be watching this that are from Birmingham, so that might also be Blazers.
Okay, I'll elaborate on the UAB part. I went back after I got my bachelor's in nursing, and I went back and I got my nurse practitioner. So I graduated in 2018, and then long story short, all the jobs that I've had, COVID was actually one that caused one of my job perspectives to fall through. So yay, COVID. Anyway, so now I'm still doing the nursing and with the I'm toying with actually going back to get a post-grad certification so that I can make myself more marketable so I can actually find a job as a nurse practitioner, which is what I have my last degree in. So.
And so what is what is this next degree? What would that be? Well, that would be 3 degrees. So it'd be PRN, RN, and then.
Well, I got my associate so I could go ahead and start working and make money. And then I got my bachelor's while I was already working as a nurse. And then I decided to go back and get my master's, which was my nurse practitioner. But I got it in women's health, and that's kind of limits, especially out here in this area. It's a little limiting. Hindsight's 2020. I didn't realize that at the time, but that's okay. So now this would be not another degree, but it would be a certification so that I could actually expand my scope of practice and, treat people beyond, not just women, but also adults and, men and that kind of thing. So just expands my scope of practice. So I'm more marketable.
Wonderful. So now that everyone has met you, knows that you guys are legit, let's talk a little bit about how you wound up, both of you guys, coming from Georgia to New York City in the middle of the pandemic. How did that work out? What drug you guys up there? Were you asked? Were you invited? Did you apply? How did that work out?
Yeah. Well, one day Gina and I were working together. And she started, I got a friend who's there. And I'm like, I've always wanted to go. I've always wanted to do something like that because I've always wanted to do missions. I've always wanted to go to third world countries and help people. And she was like, I want to do that too. And I know somebody that's there. And she goes, are you interested? Yes, I'm interested. Yes. And then there you go. It was quick.
It was very fast. We left like 3 days later.
Yeah. She found the company. And then 3 days later, 4 days later, we were going. Something like that.
And you guys were there April to May. So you guys were literally there during the middle of the explosion of the outbreak, correct?
I think we were kind of there on the past the really, really bad stage. We were about 3 days past the worst. It was getting better, but it was still obviously challenging.
So when you say getting better, I mean based on what we were all being shown on TV, it might as well have been the zombie apocalypse up there as far as what we were being told. And so, what I would love to hear you guys describe is what your experience was in New York City. Was it like it was being presented to us in the media, or was your experience up there not quite as zombie apocalyptic?
Joy, you want to go first?
No.
You go ahead.
Okay. Well, when we first went to New York, I'd been to New York a few years prior, and that place is so packed. But when we got there, there was nobody. I mean, we've got photographs of being able to walk in the middle of Times Square and stand in the middle of the road, and there's no cars. So that was interesting in and of itself, is the lack of people. When I actually got to the hospital where I was, there were nurses that had already been there a couple weeks prior to when we got there, and their stories were, was it busy? Yes. Was it awful? Yes. Some of their stories were that, yes, they were in the ER where I was. You know, you can always, in any ER, you can always line up stretchers and, you know, put patients side by side, things like that. ERs I've worked in, we've done that. But their stories were, yes, there were patients, you know, lined up beside each other. They were everywhere. And to them, you know, but it was like 2 or 3 weeks of what it sounded like was bad. And then by the time we got there, all the people that had come in that had either already died, or they'd already been admitted, and now they were in the COVID units or the ICU or the step down units or inpatient or whatever. So by the time we got there, now everybody was afraid to even come out, because they were saying, don't come to the hospital, don't come to the ER. The mandates, like where I worked, they were telling patients and stuff, call before you come, don't just walk in. So, and patients were being screened before they could come into the ERs. So there was a lot of push to no longer come to the hospital. So it was the same way up there. So people were starting to not come anymore. So by the time we got there, there were so many nurses, because New York had said they needed so much help, and then they got all the help. And then by that point, it had already stabilized, which seemed, so there was 2 or 3 weeks of bad. And then everything just kind of stopped, and it was weird. It was very quiet. It was very, very weird.
Now, let me ask you this, Gina. Based on what Joy has just described, do you feel like that phenomenon was underreported? That they were basically wanted to that what we were being told, say here in Atlanta, Georgia, wasn't necessarily an accurate reflection of what you guys were experiencing up there?
I I think that what we were being told was not accurate, but some things were. But one thing I read one time was that they had brought in these freezer trucks because they had such an influx of dead bodies. Um, the hospital I was in, that was their morgue already. They had a freezer truck for a morgue because the space had been taken over as the hospital expanded, and it was something they could move out. They didn't have freezer trucks lined up outside with dead bodies. That was insane. I mean, who who would leave the body there anyhow, like in a freezer truck? Like that was just like a blown out of proportion comment that found to be inaccurate. But um, I know 3 days before I got there, they said, and I got this from very reliable people. Ironically, I ended up working in the same hospital, which was the Queen's Emergency Room, with a good friend of mine who's a nurse practitioner from Anniston, Alabama. So she got there a week before us, maybe 2 weeks before us. And she said 3 days before I got there, it was total chaos. They had stretchers lined up so closely together that you couldn't get between them. And they were having to choose who they could treat and who they wouldn't treat based on the acuity, how sick they were, because they didn't have the staff and they didn't have the equipment. And that was just 3 days before. And so they literally had to let people lay there and die uh, comfortably. But they did pass away. A lot of people were dying, not from COVID, because COVID itself doesn't really kill people, but from the pneumonia that they had acquired from having COVID. So they were picking, we're gonna intubate this patient, but this one right here is 90 and she's very unstable. She's probably not gonna make it. So they kept her confident. So they had to actually decide who they were gonna be able to help and who they weren't. So
So,
that really did happen.
um, okay, and so that one of the things that we were presented with, and more in the hysteria, were these mobile hospitals. You've got a mobile ship that's there, and you've got Central Park has got these MASH units that don't appear to have ever been used.
I'm
Okay, I
And-
got
and-
comments.
So what's the real truth there? We've got
I
these
got comments.
these hospital ships. So tell us, Joy, what's the straight dope on that?
Well, even that ship, they said the one that they finally sent away, I think, what is it? They treated, was it 300 total people there? And there was a group of nurses that was, they came through it was I don't know, like a military traveling company or whatever. So they hired all these nurses, and I ended up working with some of them. And they had set up the mobile triage hospital, and I think it was, what was that big arena that in New York that they turned into the hospital? Well, they said they came early. They had and they set up everything. They did set up the rooms, did all the equipment, put up the stretchers, blah blah blah. And they said, and then they sat and they waited, and they sat and they waited, and they waited and they waited. And every single day there was nothing to do. And so finally, some of the nurses were like, we want to go do something. So some of them volunteered to come to the hospitals. So that's where I met them and talked to them. And they gave me that perspective that they had, so they had agreed to come here for like 30 plus days and work in the triage, that hospital, the overflow, that I think they ended up seeing 30 something patients is what they saw. And I know that what the Samaritan's Purse was set up in Central Park. And I mean, I don't know their stats or how many they saw, but when we drove by, like to go to work and stuff, you didn't see any activity there. So was that blown out of proportion? Absolutely.
So what do you attribute that to? Because we were told that the healthcare system was so overrun that it just could not absorb everybody. But the fact that those portable hospitals weren't utilized would lead me to believe that maybe it wasn't overwhelmed. What do you think, Gina?
Well, from the hospital I was in, they were very busy, but the bigger factor in that was that all of their staff had gotten sick and they had been staffless. So they had no nurses, they had no mid-level providers. They were short doctors. On the ER I worked in, every single nurse there had gotten sick except for one, and they had been out of work for 4 to 6 weeks. So they were very busy, and they had no staff. So that was the bigger issue with this particular hospital, that they couldn't take care of people based on staffing,
And
and they needed the nurses.
So whenever you say you got sick, these are people that got sick with the virus as a result of being exposed to it, or okay,
Yes.
all right.
Initially, that hospital told them not to wear masks because it would offend people. So when it got hot, they were not wearing any protection.
And just as this is a curiosity for me, were you guys ever instructed by administration to not talk to anybody? Were you guys ever, censored, as they say? Were you guys ever compelled to not kind of tell your story? We've heard people say that were you guys ever told to not say anything?
I wasn't.
Okay. There have been some voices that have gone online, and it's almost, and they've said, well, yeah, I'm not supposed to be saying this. I'm giving out information that I'm not allowed to give out. I'm putting my job at risk by exposing this information. And I didn't know if that was real, if these people really are being compelled to stay silent about what their personal experiences were.
No, it's funny. A friend of mine that's a pharmacist, she runs a hospital pharmacy for I think 3 hospitals, and she's been told she's not to discuss it with people.
Really?
She can't say, hey, I work here and this is what I think. She can't. She can't name her employer, and she's been told not to tell people her opinion.
Now, what is your all's view on the nursing home situation in specifically New York City? Because that is getting a lot of play right now, and everybody wants to string up Cuomo for what he did. Was that a bad call on his part? Should he have known better? Was that a failure? What do you think?
I think the whole nursing home situation everywhere was a failure.
Well,
I think what they've done to the patients there is horrible.
Well, when you're dealing with, and we all know this, the most fragile in society, of course, are going to be your infants, your babies, your immunocompromised, and your elderly. Well, when you're in a nursing home, because I did hospice for about 5 months, when you're the majority of those nursing home patients, especially if you're in the memory care units and stuff like that, a lot of them are on hospice. So obviously they have chronic conditions, comorbidities, and a lot of them can't advocate for themselves because they have dementia. So there's a lot of factors there. So why would you, at the cusp of a pandemic, why would you send sick people into a nursing home why would you do that? That doesn't make any sense.
And why do you think the reasoning for that was? What was the logic behind that?
I have no idea.
Because it seems like it seems like that we've got a lot of experts out there telling us all of these other things that need to take place. And it would seem logical that you would not put sick people into a environment with the most vulnerable people.
Especially with the staff at nursing homes typically are not, I don't want to offend anyone, but they're not really educated in medicine. They are caretakers, and they, I think, following the proper steps to keep from spreading it from patient to patient, that's not been done. The healthcare workers in the nursing homes are the people who are spreading it because they are isolating patients to their rooms. So the only people coming in and out are the people taking care of them. And that has really affected the nursing home numbers.
So, moving forward a little bit here, and I would like for you guys to give us some quick education on what actually is this we are dealing with. So I know it's COVID-19, which does that mean that there were 18 other COVIDs? What is a coronavirus? Do we live with them every day? Have there been other coronaviruses that we have survived that weren't quite so politically explosive? What's different about this one? What makes this unique, and what is this that we're dealing with exactly?
Who knows the truth to that? You can't trust the media.
Are there other coronaviruses? Yes, because you can look at the back of the bottle before they started and said, yes, treats against coronavirus. Everybody said that. Are there different strains of coronavirus? Yes. Are there different strains of influenza? Yes. There's all that. So, I mean, why this one came up and became I don't know.
Why it blew up?
I mean, from the get-go, yes, I understood why they had the response that they did because China hates us. Obviously, we know that. That was a big blanket statement. Sorry if I offended anybody. Anyway. But, so is it bioterrorism? Of course, I get why they did what they did. And then when you start studying, is it a virus? Yes, what they're learning, it is a virus. And does it spread like a virus? Yes, which means it is droplet, which means it could be aerosolized, which means it could be airborne. So, but is it anything new that we haven't seen before other than being a different strain? I'm not a virologist. I'm not an epidemiologist, but I mean, what they've come out with and what I've read, no. I mean, if you look at the stats for influenza, I mean, that influenza has been a pandemic. When it comes out with a new strain, there's a pandemic. We had one in 2009. We didn't make a big deal about it there, but we had over 1 million people die of it, but it didn't become a big debacle like this thing has become.
And that,
so and ask yourself why.
That's my question. What, in your all's estimation, so like H1N1 is what you're talking about, the swine flu.
Correct.
When that came out, I don't even remember it, quite frankly.
Yeah.
I don't remember
I
it even.
didn't either.
All I
And
remember is them saying there's a vaccine and the lines are so long to get the vaccine. That was it. But I mean, you can talk about who was in presidency then and how well they handle it and blah blah blah. And I can really tick people off. I can say because Obama was the president then. Okay,
now,
I don't care.
what so what is the difference in this and H1N1? I think that's something that I've been confused about. Is it more lethal? Is it more contagious? Or is it just more political?
Well, I've got some stats for you. So
Okay.
because
Okay.
I probably knew this was going to happen. Okay. So this is all CDC. I pull this from the CDC. We know that we have issues with CDC now because of some of their reporting, blah, 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 their associations, blah, blah, blah. I know definitely the WHO is one that's now like, oh, linked to China. Okay. But it says, I pulled this from CDC. COVID-19, there have been approximately 742,048 deaths reported worldwide. In the U.S., there's been 164,545 deaths that have related to COVID, and that's of August 12th, 2020. Now, the flu. This is the World Health Organization estimates that 290,000 to 650,000 people die of flu-related causes every year worldwide. And then there's this. This was written in March 2019 from the WHO. And this was, I could go back to, I've got all my links pulled up. So if anybody questions me, I can pull it up and show them. Influenza remains one of the world's greatest public health challenges every year across the globe. There are an estimated 1 billion cases, of which 3 to 5 million are severe cases, resulting in 290,000 to 650,000 influenza-related respiratory deaths. WHO recommends annual influenza vaccine, blah, 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 blah. That's from their site. But I don't think people understand that. COVID is the first in our lifetime disease process that's, besides HIV when that came out in the 80s, or was discovered in the 80s, that especially with social media, that has just turned the world upside down, right side up, whatever you want to call it. I mean, it's amazing, but I don't like, even lay people I talk to, that this is their first instance of having to actually think about, oh my goodness, there are viruses and diseases and things and blah, blah, blah. This is all new to many, many, many people. And they don't even know that, flu kills people. You realize that, right? People die every year in the United States of flu. Flu season in the hospital is absolutely horrendous. I mean, you got risk factors when you get the flu, you die. I mean, we've seen it in the ER. I know Gina and I have worked together when we've had to help people that diagnosed with pneumonia and stuff like that. And I'm not downplaying COVID. I'm not downplaying COVID deaths. But if you look at the stats, and I have those stats, which I'll tell you guys later, the percentages, breaking them down, I've got all that written down because it's got to be put into perspective, because we've taken this out of perspective and it's scaring people. And that's what makes me upset about this whole thing, is the fear mongering and the fear. And it's just not, it's wrong.
So let me ask you this, based on the stats that you have right there in front of you. So comparatively, even if COVID is worse hypothetically than, say, the regular flu, mm-hmm. rank them. How much worse is it? Is it 100 times worse? Is it just a few times worse? Because basically what we've done is we have shut down the world over something that might not be that much worse than the flu. Am I getting that correctly from you? Is that what you're telling us that your belief is?
Do you want to talk, Gina?
So you go ahead. I see you've got something to say.
This has just driven me so crazy from the get-go. I try not to be opinionated at work, and I try just to be a good nurse and go to work and just wear my mask, wear my PPE, and just be quiet. And then sometimes certain people ask me things, and then I can't be quiet. And so I had a coworker ask me, she said, and I was talking about the mask, and she goes, so when is a good time for you to actually wear a mask? When do you think you should, or when do you think it should matter? And I looked at her and I said, when I know that if I were to breathe it or touch it and put it to my mouth, or it were to infect me, no matter what, it will infect me 100% of the time, or even 50% of the time, no matter what my risk factors are, no matter who I am. And if it were to actually cause harm and kill me, no matter what my age, or, you know what I mean? If it were like sarin gas, if it were like, airborne anthrax or something, where it doesn't matter who you are, where you are, whatever, if it gets on you, I don't care how old you are, how young you are, I don't care how healthy you are, unhealthy you are, you're going to get it 100% and you're going to die. Do we see COVID this way? No. You know why? Because the data that we actually do have coming out, whether the test be, the sensitivity and specificity of these COVID tests are, they're flawed. I think it's 80 something percent sensitive or specificity for the positive results, or false negatives, false positives, because all tests are not, infallible. So as far as the data we're getting, we're at the mercy of the data reporters that they're telling us all the truth. So that being said, the data that we are getting, does it show that it's up there equivalent with influenza? Yeah, because I pulled up data because I was curious, because it's really bothered me. This thing for these past few months, what I've witnessed, what I've seen, what it's done to families, what it's done to people's health because they're so afraid, what it's done to economies, what it's done to businesses. It's really, really, really bothered me. So I'm one of those people, I'll get it up and I'll look it up and I'll compare and I'll think for myself, and I won't sit there and be a little, just listen to taglines or read little talking points and stuff and go, oh, no, I'm not that way. So when you want the stats, I'll tell them to you.
So, Gina, what are your thoughts on the, did we lose Gina?
No,
there
Gina.
you are. So Gina, give us there's a lot of controversy about the numbers, and they can be twisted and turned any which way to inflate them or to reduce them. There's a lot of people that we've heard reports of that died in a car accident, but because they tested positive at the morgue, they are put down as a COVID death. How off do you think the numbers are? Are they off 50%? Are they off dramatically? What are your thoughts on that based on your experience?
Well, because I believe it's so skewed that there's really no way to know what the real numbers are. But it's really crazy. I'm now in labor and delivery, and they had someone who had tested negative, a mother delivering who tested negative, whose placenta tested positive for COVID. Okay, why are we testing placenta? Is one question I have, but there's just no way to know. There's nothing that seems honest about the whole situation. I believe it's real. COVID is real. People are dying from it, but the numbers are, well, like, the tests are not accurate to start with. There's just no way to know. I don't think you can put your finger on it. I would feel like, just my feeling, 30% off, maybe.
Wow. That's a considerable amount. Because we are developing public policy and affecting people's lives.
Oh, my Lord.
Based on
Yes.
those numbers.
Yes.
And I have noticed recently that all of the hysteria is no longer around hospitalizations or deaths. Now it's just around positive cases, which I think is an interesting pivot. Whenever ultimately, I think what matters is who's dying and who's not dying, not whether you have it or not. Because
we're going to get it.
Yeah, as Joy pointed out, the flu happens every year, and a lot of millions of people get it, and millions of people get well from it. And so I think that a lot of us are frustrated that public policy is being made off of numbers that could potentially not be right.
Yeah. Right.
And just to give perspective, which is really what I don't think people understand, because if you've never had to deal with stats, you've never had to deal with disease processes or understanding percentages of who's affected, who's not, recovery rates, prognoses, comorbidities. These are all new terms for a whole lot of people. So when you're novice at something and you hear something for the first time, you of course trust the powers that be that they're telling you the truth. So when they tell you the truth, you're so easily manipulated if you have no background whatsoever. And it's irresponsible, to say the least, to have people, millions, billions of people trusting the powers that be, to be telling them the truth. And that's what makes me so angry, is because it's like taking a child and just, creating this false scenario for them to believe, and then just giggling behind their back because, haha, they won't know, because they don't know the whole story, or they don't understand how this works. So they won't know which questions to ask. They won't know that we're lying to them, or that we're leaving out things, or that they'll just believe us blindly and walk that way. And that's why I get so frustrated, because, people I love and care about, they're afraid and scared, and it's not right. I mean, it's wrong. It's ethically wrong, morally wrong.
What is your all's view on the experts? Because suddenly we've decided that, and I'll use Fauci as an example. He comes on TV and he says one thing, and then that changes, and then they justify the change because there's new information. In your all's industry, the nurses and the doctors and the people that are out there treating that, how do you guys view the experts? Do you guys trust what they say, or do you guys shake your head and say, I cannot believe that this guy's out there terrifying everybody with information that is so hyperbolic that it doesn't need to be put out on the media? What do you think, Gina, about the experts that we have been led to, we were supposed to trust?
Well, obviously I don't trust them, but in the beginning, things were changing daily as we were learning more about the virus, and every day, it was a little more information, and we're building on that information, and coming up with some real statistics. I believe, to start with, it was more honest. It was a real virus. It really was making people sick. We really were seeing a lot of people in the hospital. And at that point, I think that it was more factual information that we were gathering, and we were learning from it. I totally bought into the mask. I bought my family all masks. I was cleaning everything. When people ask, what should we do? I was like, wear your mask to the grocery store. When you come home, wash all your products that you purchased, because we didn't know what we were facing. And at that point, I believed that we needed to protect ourselves. Somewhere in there, I went, wait a second, this is starting to stink, actually. I don't wear a mask when I go out. People look at me crazy. It's ridiculous. I wouldn't wear one at work, because of where I work. I'm not in a high volume of COVID patients now. Um, it, it's ridiculous that this is changing our life, and the truth just got lost in there somewhere.
And what do you guys think about the voices that are being discredited and silenced? I think it's interesting that in something as big as this, the best policy would be to shrink the amount of available information. I think that's really strange. You would think we would want more information, but as soon as somebody comes out with a different idea, I mean, they are just smashed and discredited. For instance, the frontline doctors that came out and gave their press conference. How do you guys in your industry view something like that? Do you guys think that that's a good idea, or do we need to have more voices?
More voices.
Well, you
What do you
always
think, Joy?
talk about evidence-based practice. We're supposed to all peer review, and we're supposed to talk to each other. And even in the schools, like, the biggest push right now is interdisciplinary teaching. You have to learn to work within the disciplines, and so y'all can communicate and collaborate. I mean, I've taken courses where we had to actually work together as teams, being adults. I mean, you thought that was over with when you were in elementary school. You weren't going to have to do team group projects, but they're pushing it now in the medical education. It's a requirement in order to graduate and get a master's, whatever degree. You got to learn to work together as a group and as a team. So you tell me what a dichotomy, how hypocritical that is to sit there and go, we're teaching our doctors and our mid-levels and our nurses that they need to work together as a team and utilize each other and play off each other and learn from each other. Oh, well, we don't like what you had to say, so we're just going to shut you down. It's
right.
Such hypocrisy. It's ridiculous.
And what about freedom of speech?
I mean, there you go. Our Bill of Rights, our Second Amendment. I mean, not our Second Amendment.
I've never. Well, and we may need the Second Amendment real soon.
Yeah.
We may have to use the Second Amendment for whenever all this goes down crazy. Well, okay, so this conversation is leading where I assume that it would, that there's a lot of information that seems to be politically motivated, where there was an agenda that was developed, and they're utilizing the fear of an unknown virus and are able to manipulate the numbers to really put us all in terror. But I'm not necessarily seeing the evidence of that on the street level. I'm not really seeing people that are terrified like I think that they want us to. And I wanted to ask you guys a little bit about the responses that were then proposed as a result of this. And if you think that they had any bearing or have any bearing on whether it has, as they say, flattened the curve or help people. Do you guys think that quarantining the entire United States made any sense in this situation? What do you think, Gina?
I think no, absolutely not.
And why not? Why do you think that? What was the downside of quarantining?
Well, the quarantining thing to begin with was we need to keep as few people from getting this as possible because we cannot handle this. Our ICUs are full and our emergency rooms are full, and we can't handle the numbers of people who are going to need this kind of medical treatment. But that quickly, we kind of got over that hump very quickly, and what you're seeing now is a lot of people who test positive, but they're not actually sick. So I think that the going back to regular life, and it's a virus. We have to go through it. We cannot go around it. So it's inevitable that we're going to go through it. It's inevitable that people are going to die. It's inevitable people are going to be sick. But you're seeing the numbers go up, but you're not seeing the deaths go up. You're seeing the number of deaths going down. So I believe that we're doing the right thing by getting out and living, and that's going to change the severity of the deaths. I can't really put that into words right now, but we're working through the virus now, which is the only way to do it.
So, Joy, let me ask you this. There is one of my biggest frustrations, and I think many people that are listening and watching right now, has been the inconsistency of the guidelines. So, for instance, the mom and pop store can't be open, but Walmart can be. The restaurants can't be open, or they can be open till 6 o'clock, or you can only serve alcohol after. It doesn't seem to make any rhyme or reason. Can you explain why they came up with this as best you can? You may not agree with them, but why would they come up with these guidelines? Why is it okay to go to Lowe's and Walmart and Home Depot, but it's not okay to go to the mom and pop antique shop? Where did that come from?
Well, the only thing I can say is that the small business is the backbone of our economy. So if you destroy small business, then everyone's going to become reliant on government to bail them out, help them, and then government becomes the giant entity that it already is, but it's only worse. That's the only thing I can say. All I know is that big perspective, the stats speak for themselves, and the stats show that we are destroying our GDP. I don't even know what it would. I remembered, I read the stat the other day that we've lost a third of our GDP because of all this mess. As a country, you can't survive if your small business owners aren't there, if they're not paying their taxes. Then we just end up socialism, which leads us to communism, and there you go, we're gone. So
as professionals, you guys do not see any logical reason for the guidelines at this point, or at least the what stores can be open, what's essential, what isn't essential. To a industry professional, those don't make any sense either. Correct? Is that?
They don't make any sense to me. I mean, when you have this is my stat, and this is for perspective for everybody who's like, well, you guys are crazy. If there's 7.8 billion people in the world, this is John Hopkins stats for today, 20,284,882 positive tests. Okay, this is for the world today. That being said, per our 7.8 billion population, that means that is 0.002% of our population that has tested positive. In the United States, we have 328.2 million. As of today, there are 5,180,226 positive tests. That's 1.65% of our population that's tested positive. Now, these are not positive tests because people were symptomatic. These are positive tests because employers are requiring to have people test. People are running up to the health department because they're scared out of their mind. So they want to know, because I had a sniffle or because I sneezed, I need to know if I am positive or negative. This is unprecedented in healthcare for you to be testing people without symptoms. If you come to the ER, we are not going to test you because you come in and say, I want this test, and this test, and you have no symptoms. The doctor cannot qualify ordering a test for symptoms you do not have. But this is the first time where it doesn't matter if you come in and go, I want my test. It's like we're having to bow down to, okay. I mean, we had a memo from a business that was sending their employees to our hospital saying that we were there to provide them free tests. And we had people coming in like crazy, coming to get their free test. And we had no idea.
So the stats that you just put out there, that's information that we need to hear. How does that compare to the flu or the pneumonia or H1N1? Is it in line? Is it about the same? Is it incredibly more aggressive? I think that perspective is important for people to understand how COVID-19 compares to something else, so that then we can base how we compare the response to it. So how would those numbers compare to something that's happened in the past?
Well, like even with the flu stats, like when I was looking that up, and I read that to you guys earlier, just about 290,000 to 650,000 people die of flu-related causes every year worldwide. But the thing is COVID, they are tracking it. Okay. So CDC came out with, or the Health and Human Resources, I don't know, they came out with a new coding system that doctors were mandated to code a certain way in order to link a death to COVID. And I pulled those up and I read that. I read the instructions on what the doctors were given in order to, when they were filling out death certificates. Flu does not, they don't do that. They don't record or follow trends of flu deaths. So there could be more flu deaths that we don't know about because they're not recorded. There's not a mandated following or reporting of a flu death. Also, people who get the flu every year don't go out and get tested. A lot of people just stay home. But now with COVID, it's like the fear is propelling people to go out if they have a sniffle. And we have people coming to ER all the time, and they're just scared because they got a sniffle, and so they think they're going to get COVID. And a lot of to me, that I've recognized talking to patients and people coming in, is the perspective is, or the belief is, that if they catch COVID, they are going to die. A lot of people think that, and that makes me so angry because it's not right. Because the misinformation out there is creating so much fear that we've got so many 1013 patients, mental health patients, people that are depressed, people that have gone back to drinking, gone back to smoking because they're scared. And that's just, it's not right. I mean, and you can look at the stats. I mean, I've got the stats, the death stats. If you want to look at the death rate worldwide, there's 744,941 deaths reported worldwide related to COVID. Based on the percentage of the population and the death rate, that's 0.0095% death rate. That's very small. If you look at U.S. death rates, you want me to stop?
No, I want you to keep going. But what that's the question I wanted. Is that a big number or a little number? Is that number big enough to justify shutting the world down? Is my question.
0.0095%.
Thank you, Joy.
Those are people that are recorded. We don't know how many people are born on this earth in these little tribes somewhere in Africa or whatever that we don't know how many people there are in this world. We just know recorded wise there's 7.8 billion. So we act like we know so much. We don't. We know this much. The world is this big. We know this much. It's okay.
So, all right.
You know,
So,
in our
What?
I was just gonna say, in our industries as nurses, most of the people that we work with are on the other side,
They think they know everything, and
and
I don't.
they're wearing
I just gotta
and
look
they're
at the numbers and use my common sense.
right,
I
and
mean, you
they're
guys
wearing their
know.
mask religiously. They're so afraid they're going to get this virus, and it blows my mind that they are falling into the same pattern as someone who doesn't know better.
Well,
now,
here's our death rate. Can I give you
okay.
this one for the United States
Yes,
for
please.
perspective?
Definitely.
Okay. This is all Johns Hopkins data, okay? I just know how to do math, okay? So I take their data and I make my percentages because I know how to do math. I used to teach math too. Anyway, so in the U.S., there's 165,510 deaths according to Johns Hopkins today. That is a zero based on the $328.2 million reported U.S. population. That is a 0.05% death rate. Okay. Based on that, if we have 5,180,226 positive tests and we've had 165,510 deaths in the U.S., that leaves us with a 99.99% recovery rate. So you're going to shut down the world for a 99.99% recovery rate. Really?
That
data. I mean, whether they're all 30% or not,
That doesn't make sense.
on.
that is a stat that everybody needs to hear. They don't have to believe it. They don't have to appreciate it. But that is from John Hopkins, correct? Those are the stats those are the experts that everyone is telling us that we need to listen to.
I didn't want to use the WHO. I didn't want to use CDC because people have their opinions about them right now. So I pulled straight from Johns Hopkins and actually that's the recovery rate. So if I do my percentage, which I've written all this out and did this. So basically, if you've got, let me look at my number. If you've got 165,510 deaths, you've got the, let me see the total, the 5,180,226 positive tests. I subtract the deaths from the positive tests. So that leaves me with 5,014,716 that recover. Okay. So if you test positive, whether you have symptoms or not versus the death, there's your recovery from the people that actually die and the people who don't, who actually test positive. So I'm changing my stat. I was reading the wrong one. So then that means that there is a 98.5% recovery rate. That means we have a death rate of 1.5%. Okay. Even then, that is a low number. So your recovery rate is 98.5%.
So if you get it, there's a high likelihood you're going to get better.
98.5%.
Exactly. Now let me
that's right there with the birth control. And people base their fertility on birth control.
Right. Well, that is a great perspective. People trust birth control, right? They're willing to trust that. So, Joy, Gina, let me ask you this. You mentioned something a minute ago that is become heresy in our society, and that is that you don't wear a mask. Oh my goodness! Now, full disclosure, I don't either. I don't feel like I need one. I do not wear one out. But all of a sudden, it's like we've got this mask shaming going on where you walk into a place without a mask on and, oh my God, you need to be tried for attempted murder. So my question is this. I look online and I see images of what virologists wear. And it's a full body suit with, headgear and respirators and stuff. However, I'm supposed to believe that a bandana around my nose is going to be effective at doing this. Now, I'm told that, well, do it because it's patriotic or do it because you're protecting someone else. What exactly is the logic behind the mask? What is it supposed to do, and what does it do? Gina.
Well, I don't have the statistics of how well they filter out germs, but we do wear, and I've always worn masks in surgery. So there is some benefit, in my opinion, that if you had serious health issues, I think you should wear a mask. It's going to filter out something. It's going to, for the person who has a compromised immune system, they need to wear a mask. In my opinion, to be on the safe side, I do believe it does give you an advantage over not wearing one in that situation only. Otherwise, I don't wear one. I'm required to wear an N95 at work, and I do wear that. And I think it's horrible, and I don't think I'm saving anyone. I'm not saving myself from getting sick. It's just an inconvenience. Um, but if you are sick, you should stay home anyhow. But if you are going to go out and buy your groceries and you're having a compromised immune system, I think you should wear a mask. I think there is some protection in it. Is it even, I don't know the percentages, I don't remember. But for everybody else, I don't think it's useless, especially sending children to school with masks on. That their dirty hands on their face is, to me, in my opinion, going to be more of a germ spreading problem than covering their face all day at school.
What do you think, Gina, about the mask? What's your theory on the mask?
Joy?
Pro or against? Joy, what do you think? Yeah, I'm sorry.
I don't wear a mask. I don't make my kids wear them. It's optional where they're going right now, and I don't make them. Is there some validity in wearing masks? Yes, because we do them in the hospital. Before masks became the thing, and now you can buy designer masks on Zulily and all this kind of stuff. We wore masks when we had, if someone had the flu and they were positive for a flu, there was a lot of people would wear a mask when they go in the room. But when you're wearing a mask, why are you wearing a mask? You're wearing it to protect yourself from them when you go in and then you leave and you take it off. Or if they have TB or something, then you wear your N95 and you go in. If they have things like that. That worked in the healthcare field, because we're around sick people and we know this. So then you wear masks, or like Gina said in surgery, you wear masks there because you're trying to protect. Of course, if you happen to blow and sneeze and you're hanging over a sterile body, that's not really the best place to do it. Those things make sense. Healthy people walking around day to day wearing that kind of stuff, especially when it's a virus, just like we walk around and you think COVID and flu are the only viruses out there. There's bacteria. Let's not forget. There's bacteria, there's fungus, there's viruses, and there's lots of them. There's not just the two that we're talking of that, so our bodies are designed to work, to fight infection. And if you don't expose it to the things that your body needs, which is the foreign substance, the antigen is what you want to call it, in order to mount an immune response, then what's your body going to do? So sticking people in their houses, for weeks on at a time, what's going to happen to their immune system?
So
it's not going to be that good because you're not being exposed to anything. It's just like we went through the craze of, everybody washing their hands and everybody, using hand sanitizer and stuff with little kids. I mean, little kids are losing that immunity that they should be building when, us as kids, we probably rolled around in the dirt and ran around barefoot, our bodies were designed to be exposed to germs. And anyone who knows immunology knows that.
So let me ask you this. I'm curious about this. As professionals in this industry, as far as PPE or as far as hygiene habits are concerned, to protect yourself from these things, what would be your list of what's most important all the way down to? So like, is it hand washing? Is it staying away from people? Is it wearing masks? So what would be your advice, your hierarchy, your top 5 things to do to protect yourself? Or what do you do that would be your top 5?
I wash my hands with soap.
Hand washing.
And so like the difference between washing hands and mask wearing, if you could only choose one of them, what would you do?
Hand washing.
Soap
Hand
and water.
washing.
And then what would be after hand washing?
Well, during flu season, I typically have worn just the little thin mask that we have because I didn't want the flu. Not because I was afraid I was going to die, but I wanted to work and I didn't want to get sick at work. So in the 7 years I've worked in the emergency room, I had strep one time. Other than that, I've never gotten anything. But I did wear the little mask just during flu season just because I didn't want to have it. I've had it before, but I lived. I just didn't want to get it again if I didn't
The
have to.
inconvenience of having to stay home and not work.
Yeah, I didn't want to miss work.
So your all's
The biggest
advice is that hand washing is the most critical thing that people could do right now to protect themselves from this. More so than being 6 feet apart or wearing a mask or
that is going to reduce. The 6 feet apart is a non-invasive, non-life changing way to germ. I would give somebody their space.
Yeah, the biggest thing is it's just common sense. If you're sick, you got a fever, you don't feel good, you're snotty, you stay home. Number one, stay home.
right.
Wash your hands.
Stay home
all the time. I mean, I teach my kids this. If you blow your nose on a Kleenex, guess what? Throw that tissue away and go wash your hands.
And go wash your hands.
Because you get your germs and your particles and your gunk on your little fingers, and then you're a little kid and you run around and touch everything. But people don't do that. People rub their noses and do like this, and then they go around, and you wonder why just because people just aren't conscientious of it. This made people conscientious of, oh my God, I'm supposed to wash my hands? Really? I mean, more people don't wash their hands, because like when they started the new hand washing thing, it was like all the memes going around about, oh my God, hand washing. Wow, what a new concept, blah, blah, blah. So more people don't wash their hands, than we realize. So right there, that's a big thing. Stay home when you're sick, wash your hands. If you sneeze, you're getting your bacteria, your germs, your particles. If you do this, go wash your hands or sneeze like this. I mean, it's just little things like that. It's just simple common sense things you think it, but apparently it wasn't. You know what I mean? And don't sneeze and cough on everybody's face.
Let me ask you something that is kind of a common sense question, I think, is that we're being told that, okay, you wear the mask because you've got to protect other people from you potentially spreading this. However, in order to get tested, they have to shove a Q-tip to your brain. If this thing was so contagious right here, why is it that they have to test you at your brain? Explain that to me. What is that about?
Well, first you're swabbed in the throat, and then they go to your brain on both nose holes.
And so why is if this thing is so contagious right here, and I could cough it out, why couldn't you just cough into a napkin and test it?
I think potentially you could. I'm not sure why it's so invasive.
It just seems
in your poop too.
COVID is?
Yeah, there's the National Library of Medicine, National Institute of Health. Yeah, I mean, they've tested some of the stool from the patients in China, and they're live COVID in there. So another reason, wash your hands, oral fecal route. A lot of people get sick when they go eat at a restaurant because nobody washed their hands if they went to the bathroom and you ate their poop. So, but yeah, that's just a little fun fact that I read when I was reading my stuff.
I didn't realize that.
Yeah.
It makes sense though.
We are educating people worldwide right now, and that's the whole idea here. Give new information. But I thought it was so interesting that that the test is so invasive whenever we're being told that this is the most contagious pathogen ever known to man, and you would think that literally just exhaling, they would be able to get a sample and test you that way. So, well, all right. I had the young lady, Nita, Gita Noren, who was a nurse that was on our first episode. She had a really good question, and she wanted to know what your all's thoughts were on the response of other countries, and which countries do you think responded the best and why?
Oh,
Ugh, I can't even remember. I have read about that, but who is it that's right there by China that's like separated by only a few miles?
you talking about?
Who has the very
You talking about
they have
New
the very
Zealand?
low? No,
No, I'm not talking about, but I know New Zealand. I think Sweden, just because I read that they did the least amount of isolating and allowed their citizens to kind of make their own choices. And I did read a little bit about when information was coming out, they only like limited restaurants like closing at certain times, but they didn't tell people they had to stay inside. They didn't tell people that they had to wear their masks. They allowed the citizens to make their own choices, and based on that, just what I read, that a lot of the citizens just made their own choices to stay home. They just decided they wanted to work from home, or they didn't. So, that being said, I understand they're more of a socialistic, kind of nation, but nonetheless, they let their people be people and actually think for themselves. And that's the biggest thing, is that, and people are like, it's just this thing, it's just a mask, it doesn't matter. I mean, you give them an inch, they're going to take a mile. If you've paid attention to politics, if you've paid attention to history, period, you know how that happens. When man gets a hold of power, all they want to do is just take it and run with it, and that they're not going to stop. But I could go into a lot of a whole different subject, but if you look at Saul Alinsky model, if anybody hears that, look that up. That is a right out of a playbook from the
Rules for Radicals.
Thank you. Where you don't let a catastrophe go to waste. You take it and you use it, because when you back somebody in a corner and you have them full of fear, they'll do anything for you to stop it. And that's just terrorism right there. There's something you would never ever do in your life, but if you back somebody in a corner, you threaten them, you make them think their life's going to come to an end, guess what? They'll cave, and they'll do whatever it is you tell them to do just to stop the pain, just to stop the problem. They'll cave. And that's what I see happening here. And so you've got a lot of well-meaning people that are just like, they just want this all to quit. They want to feel safe. But if you want to give up, you're going to give up your freedom for a little bit of security. And no. For who?
So,
who's going to?
So here in the States, whenever this thing hit, and Gina pointed out that there was the fear of it being overwhelming, and it's so hard for me to believe that the advances of medical science that we have here wouldn't be able to control this thing, that there wouldn't be some type of a treatment or something that would have been ready to go right out of the blocks. So why did it appear that we kind of got caught flat-footed on this deal? That there wasn't something that we could do to get these people well in a hurry.
The virus.
There's no treatment except supportive care.
And so what made this different from a lethal point of view than, say, the flu or any other virus? What was it about it that made it unique in that respect?
Well, it was new, and our bodies hadn't seen it before.
There's a new strain, just like flu, just like H1N1 was a new strain of influenza. Sometimes they mutate, and when they mutate for whatever reason, because I'm not a virologist, I don't understand the whole full mechanism of why they mutate. But then the body has to mount an immune response, and then once it does, the sad thing is you can look at the animal kingdom, the way it works. The predator goes after the weak and the old, and that's the way it is. I'm sorry. And if you look at the stats of the people who died in New York, which is a fifth of the deaths occurred in New York City, you look at the entire country, a fifth of the deaths occurred in New York City. And I looked at the stats. It was in Kings County, the Bronx, and I forgot the other one. But anyway, it was
Uh,
3 counties in New York. Where? What'd you say?
it's, well,
Do you
maybe
know?
wrong, so go ahead. No,
But
go ahead.
but the stats, if you look like the demographics and the health of those people that were there, a lot of them were very obese, lots of comorbidities. I think one of the stats I read, it was Mont Haven, which is in the Bronx, which is where I was, not Mont Haven, but I was in the Bronx. It's where the hospital I was. A lot of the patient population there, like 30 something percent of those people were not from America. So we don't know what their health status was. They could have been illegal. They may not have, they don't have health, like preventative health care, may not have their chronic conditions being treated. And those are the big risk factors related to COVID. So if you look at all the areas where a lot of the people are dying or they're having issues with the hospital systems, it's in the densely populated inner city areas. Like I know some people that are in Texas and where they are, and I asked this one particular person, what is her patient population? A lot of them, she said they're all a Hispanic patient population. It's all along the border, like of course close to Corpus Christi, around the border of Texas. So I mean, there's a lot of variables that people don't understand that they should be looking at as far as why certain people are dying and then where these deaths are occurring. And like you said, with certain viruses, why do some people get it and some people don't? Well, there's susceptibility, there's genetic predisposition that we don't understand. We don't study and test everybody for any genetic abnormalities. A lot of these people have blood disorders that may not have been diagnosed yet. And a lot of African American people have blood disorders, sickle cell, they can have sickle cell trait, and they don't know that. And, a lot of like I said, like in New York City, there's a lot of Hispanic, a lot of African American population there. That was the biggest up in the Bronx. Their patient population is Hispanic and African American. And there's a high percentage, like 40% are obese, and they smoke, and homeless. There's poverty, and that's health disparities. So it puts people at a greater risk for being susceptible to disease process as opposed to middle America, suburbia, places like where we are, where we have better access to better health care. So there's so many variables that a lot of people don't say. And that's what I was saying. The powers that be understand that a lot of people don't understand that there's reasons why certain areas are having greater issues than others. And they're banking on the fact that these people just think we're all the same and we all look the same and we all live the same, but we don't. So it puts those populations at greater risk for death and dying than say people here in Villa Rica and, Carrollton and, so there's such a bigger picture out there that people need to see.
So when you guys were treating people, what was the most effective? We hear a lot about ventilators. What was the most effective treatment that you guys saw? And what was the treatment? We also hear a lot about the HCQ situation, that it wasn't allowed. Were there certain effective treatments that are not being allowed to be used, again, because of political reasons?
In Queens, the medications they were giving to every COVID patient was Plaquenil, zinc, and the azithromycin antibiotic. Um, some people got better, some people died. It was not 100%. I've seen the video of 350 people and 100% of them have lived. Again, going back to what Joy said, the healthcare lifestyle, the genetics, the available healthcare to those people. You're talking about two different populations. The people I saw at Queens were mostly homeless. Um, they were all various uh, ethnicities. Um, all of the people that were very sick had comorbidities, diabetes, hypertension. Most of them were 60 and up. I mean, these numbers, like that lady said, 350 people, everybody I've treated has lived. You're talking about totally different people, totally different everything. It's comparing apples to oranges.
And because I watched her thing, was treating those people in an outpatient setting. So the fact that they were already in an inpatient setting when we got to them or coming to the ER, they were way more advanced in their disease process than say that lady where she was treating them when she started an outpatient process, in her office. So
we're talking about people who
that's
couldn't
another
breathe.
What's that?
We're talking about people who came in who couldn't breathe, who were on the edge of death.
Yeah.
Those are the people we were
Because
treating.
they were too afraid to come in. So the people that did come in finally to the ED during that time, they were so scared to come in because the atmosphere was don't go out, don't go out, don't go out.
Right.
So
they waited till
to the last minute. Till that point, the way the body works is the body will compensate till it cannot compensate anymore. And once that hits, once the body finally quits and gives up, you've only got minutes to help somebody. I mean, and then it's hard when, like, even where I was, their ratio, which is why they had such a hard time where I came from, their ratio, the nurse, like the staff nurses there would say that, they would 6 nurses per the entire ER, which put them in a ratio of 6 to 15 patients. Dear God, no way. There's no way you can do that. There's no way one nurse.
When you guys would put somebody on a ventilator, is that a last ditch effort or is that the first thing that you do?
Very, very last.
So when they go on a ventilator, recovery is going to be a lot less likely.
Correct. Your lungs are going to stiffen. And go ahead. I'm sorry. What?
No, I said prognosis is slim.
Slim, yeah. Where I was at Queens, they came in. The first thing we were going to do is do a nasal cannula, which is the very lowest, and then we moved up to a non-rebreather, a little more push, a little more oxygen, and then they even had high flow at the hospital I was at. And then after high flow, they would be put on CPAP and then put on a ventilator. That would be the steps that we took before someone was tubed.
And the recovery rate once you're on a ventilator is pretty low. But the people, there is a demographic of those people, correct? Based on what I'm hearing you all say, is that literally you could probably look at someone and based on what you may know about their history, whether it's an underlying condition, what their recovery possibilities would be. Average Joe, healthy guy coming in off the street probably is going to have a pretty good chance of recovery.
Right, but there's going to be that one person that you really don't know their history. They appear healthy. You just never know. I mean, you're hearing these stories about, oh, this guy was 30, he was healthy, he had 2 little kids, and he was fine one day and he died the next. You really don't know what was going on there, but besides the obvious, he could have had something in his history that he didn't even know about. But there are those few people that were healthy seeming and they got it and they died. But those are far, far more uncommon. But you're seeing them in the news like that it's happening everywhere. It's not. I didn't see anyone like that.
Okay, that was going to be my next question. Did you guys see anybody die that after you learned all of the underlying circumstances were like, wow, I can't believe that this got him?
I didn't see anybody under 55.
What about you, Joy?
That died.
No. I mean, no. It's totally unrelated to COVID if they died. Absolutely.
Right.
It would have been a gunshot wound or stabbing.
Right. You were seeing all that. I didn't see any of that.
Yes.
So let's get really political here and let's talk about HCQ. What is the reality of that? Because that has been a political football that has been just kicked around. And there was obviously that Lancet report that came out and then got debunked as being a bunch of false information. And now you've got Dr. Fauci saying you can't do it. You got other people saying it's the wonder drug. What does it do? What's it supposed to do? And why does it work or why does it not work?
I don't even know if it's a game changer, actually.
Okay.
I didn't see any miracle from the patients we were caring for. I don't know that at the point where they came and got help, came to the ER for care, if it was too late. There was no turning back.
Okay. So
So,
it
and
would
then those other people
no
may have.
therapy could have saved him.
That's just what I thought.
What do you
Based
think,
on
Joy?
what we know at the time, and apart from that, I'll answer that one. But as far as I think a lot of the practice was throwing people on a ventilator because they were looking at their O2 stats, and their O2 stat was so low that when you get in a really quick, when you're ER and they're not maintaining their stat and their airways, so immediately let's intubate. And I don't think, they realize, and I think they realize more now, just based on how the patients have responded to being intubated, that intubation is not first line. That's not, you want to do non-invasive ventilation, which is going to be that high flow nasal cannula. So that being said, I think a lot of people were thrown on a ventilator too early because they didn't know.
They didn't
Yeah.
realize the repercussions with this
Yeah.
particular virus and the ventilator.
Yeah.
Your outcome is worse.
Yes. So
in your all's estimation, ventilation may have been a bad option. Some people may have died that could have potentially survived.
Probably
very
so.
well.
I've read that for whatever reason, this virus hardens your lungs, and when you can't reverse that damage, and so coming off of the ventilator is impossible.
Wow. That's and a lot of that is based on when this care takes place. So if someone came in early, Gina, potentially the HCQ would have been effective, but because it was so late, it didn't have any effectiveness. Is that what you're kind of saying?
I mean, I would say that the people that received it and died were probably just too far gone to help to begin with.
Okay.
And you get people like that coming in the ER all the time that they are so far gone with a sepsis or, some sort of infection, or you even have COP exacerbation that they come in and you can't, the damage is, like I said, the body compensates as long as it possibly can to the point where you can't go back. I mean, instead you've already done the damage and the body just doesn't have enough time before your heart gives out. You know what I mean? So that's why I said it's a very time sensitive. The way the body works, you can't play around with that.
So somebody that you knew, a loved one, that came up positive with this and was symptomatic, what would you recommend that they do first? What would be the immediate thing that you would have them do to increase their chance of survival?
Well, you mean at the point where they have the pneumonia, or
like someone has got the sniffles and the fever and the symptoms. They test and they test positive. What would happen right out of the box?
Tylenol, rest, and plenty of water.
Really? So
get your vitamin C, get your zinc.
Get your vitamin C.
Get
some
your
vitamin
zinc
C and zinc and some Tylenol and some sleep and water. Yeah.
So this would not be a situation of run to the hospital, get on a ventilator.
No.
So when do you run to the hospital? At what stage do you run to the hospital?
When you are not maintaining your oxygen saturation.
Or you're breathing over 20 per minute and you feel short of breath and you feel like you can't catch your breath. Yeah.
And now would that be inevitable to someone who has an underlying cause? Or if someone does what Gina and Joy have just said, get some rest, drink some fluid, take some Tylenol to get the fever down, would you not advance to that stage where you would have to be hospitalized? Or are the people that get hospitalized inevitably going to be hospitalized?
It
depends a lot on your history too.
It's a lot of variables there because if you're asthmatic, these people with hypertension and diabetes, apparently it just loves them. So those people are going to progress and they're going to most likely need to go to the hospital, not for a ventilator, but just for a higher level of care.
So one of the
See,
best things that people can do is be aware of their
be
own
more vigilant
health
with your
issues.
body. Yes.
Be aware. Sorry, my dogs they're deciding to weigh in the background here. So if people that are aware of their own health history can go a long way into lessening the possibility of this being lethal to them.
Quit smoking.
Yeah, smoking. Hey,
Don't
let's talk
smoke.
about how many people die every year from smoking. How many people die of smoking? The numbers are way higher than COVID, but we're
Really.
not talking about that. Oh my gosh, yes.
So let's talk about like in the spectrum of death and destruction where COVID lies. You have just pointed out that smoking is higher. Where would this fall in that hierarchy, you think,
Gosh, I would
of
need to get my phone
mortality?
and look it up.
Well,
If
just from
you
your
look,
own experience, what do you think?
oh my goodness, in my own experience in the ER, 90, 90% of the sick people that come to the ER are smokers. So that
You can
affects
spot them.
every area of your life
Yeah, you can
in a bad way.
look at them.
Do what?
Yeah, you see. I said you can see them before they even you talk to them, and you're like they're a smoker. I mean, because you can
You
tell
don't
the way
even
that they
say, do
look.
you smoke? How much do you
Yes,
smoke a day is like the first question.
yeah, you just know. I mean, we have so many habits that have just made us so susceptible to disease processes that,
And
poor prognosis from disease processes that probably necessarily wouldn't have been that bad of an outcome had we been a healthy society. But we are not a healthy society, and it's like it's coming to bite us in the butt.
And that makes us a lot more susceptible to things of this nature because our bodies we haven't taken care of ourselves to fight this off. I believe that's what you're basically saying.
Obesity is one of the highest risk factors for poor prognosis with COVID, and we have 60% of our population is obese. I mean, and obese is not overweight. Obese is a BMI greater than 30.
So let me ask you this. So hypothetically, let's say that tomorrow they just, okay, we're going to flip the switch and we're opening America back up. Everybody's going back to school. Everybody's doing everything. What would play devil's advocate? What would be the downside of that? Or would the downside be so limited that we need to do that? What do you think?
I think we should go back, but I do think there's going to be we're going to have a hill we have to cross. It will be, there will be people dying, but there will be people dying either way.
So you don't think that there is any advantage to keeping everybody locked down and in fear?
No.
Fear
that
in fact, right.
That's the one thing. You have these people, their fear, I mean, that raises your cortisol level. That makes you susceptible to disease process because that inflames your endothelial tissues. I mean, your lining in your vessels, which is one thing that they talk about of hypertension and with diabetes and with COVID, because it does mess with your immune system with that cytokine storm and all that mess that, I'd have to read more about it, but you're increasing your cortisol level because of your stress and your fear. That doesn't make you any better. I mean,
and what about all the people that didn't go to the people that didn't go to the doctor because the doctor's offices are closed? What about all the very sick people?
Those sweet little people that were coming in because they didn't go to the doctor because they had hypertension or heart problems, and I talked to a lot of them already that like I couldn't go and I couldn't get my medicine or I couldn't get my therapy from my psychiatrist, so now I'm here because I'm suicidal because I haven't been on my meds, or I'm having a psychotic break because I couldn't get to my doctor and I couldn't have my therapy. I mean, it's sad because
it seems like the domino effect that has been associated with this may be worse than what would have happened had we just let it run its course.
Mm-hmm. Yeah.
They thought that everybody was going to need to be on a vent and slowing it down so that there were enough may have made sense at the beginning. Slowing it down at the beginning, it did make sense to me because we didn't understand what was what we were facing. But now that we know, I mean, we can't shut down society because of a virus. You know, if you look through history, we've been through this many times, but the only way to go through it again is through it. We're not going to go around it. We're not going to save lives, in my
So
opinion.
I mean,
from a medical professional point of view, and I still believe that there's a huge political component associated with this. At
wait
what
till November.
point? So this thing's been going on for like 6 months now. At what point in the process did we know definitively, okay, this is the population that it is attacking? When could we have made better decisions? I understand, okay, we don't know what we're dealing with here. We need to shut down for a week or 2 weeks or 14 days. In your own estimation, at what point did we know what we were dealing with? And at that point, should have changed our response approach.
I'm not sure what point.
It was pretty gradual.
After I went to New York.
Yeah.
It just kind of evolved into it.
So I know that we're still learning as we go right now.
Right.
But at some point, you guys were able to determine, okay, this is attacking people with high blood pressure, obese, elderly, but we're still having a one size fits all response.
Right.
And at what point did we know, was that how far along into the pandemic were we into this thing before we could have made some of those better decisions? I guess what I'm asking is, how much lost time have we had here unnecessarily so?
I think by May we should have.
You remember we were in New York and I sent y'all that video and I said y'all need to watch that, and it was those two doctors from that county in California, and one of them is one of the
California.
Yeah, and they started him and his partner, they started producing their data that they were collecting on their own for their own practice and what they were seeing, and you know, they got shut down. They were one of the first where I started going, wow, this is weird, because Facebook pulled their video off and you couldn't find it anywhere. But yeah, that was when it was like, you know, I'm always skeptical, always have been. So, but that was where it was like, the data is coming out now, and this is really getting, you know, fishy and, you know, strange.
So, when it's all said and done, do you think that some heads are going to roll? Do you think that there's going to be that the population is going to call for people like Fauci and some of the others that have been out there that it seem to have made this thing extremely political? Do you think that there's going to be a demand for them to go down?
I don't think we're ever going to know the truth.
It depends on the election.
No, you say that it's all on November. After November, it's all gone, right?
On whether or not they'll get their crowning seat or they'll get booted out. I don't know.
I got you. Well, so we've gone so much longer than I told you guys we would, and I apologize for that. But I really appreciate y'all hanging with us. I know everybody's really enjoying this, and I hope you guys are cool with extending this a little longer than what we had anticipated, because you got a lot of great stuff to say that a lot of people need to hear. So I apologize right now. Now, what were we going to say, Gina? You had something to say?
I was just going to say, when at the hospital I was in Queens, there was a huge shortage of PPE. The only thing we got every day was a new N95. I taped my shoe covers. I taped stuff around my shoes. I wore the same paper gown thing for a week. I pulled my hair up. I stopped wearing the face shield because I couldn't see. I have an eye injury, and with the N95 and everything, it was all squeezing my face and I couldn't see. So I really got down to the last week. I wore the same covering over my clothes every single day. I wore two pairs of gloves, and I never actually took off the first pair except to go wash my hands. And every day I was less and less careful because I had so much to do and I didn't have time. And we would go into the ER, and we would stay in the room with the same PPE on the whole time, except for changing that outer pair of gloves. Um, and everybody in the ER had COVID, and if they didn't, they were going to because they were side by side with people who did. If it spreads that easy, but I really took a change of opinion when the last day there, I had the blood test done to see if I'd been exposed to it, and it was negative. And after literally wearing the same stuff over and over and going from patient to patient to patient, I mean, I washed as much as I could, but you can't take off and load was heavy, heavy, heavy. Um, so after I had that blood test and I was negative, and I had literally been in a several hundred people's face, it was a real eye opener that, hey, this is not as contagious as I think. Um, and the people I saw, all older, all sick before they got there, most of them homeless. It is attacking the weak. It really is attacking them, and it is a very, very terrible death and sickness when it progresses to that point. I mean, it's a very real virus, and it causes a very real pneumonia, and it causes you to feel very bad. But after seeing that, most people are never going to experience that. And
Mhm.
so when I came home, I took a whole different. I was like, I'm done with the mask. I'm done with all of this. I'm ready to go back to the real life, the real world, living and loving people. People in the nursing home who are there with zero interaction. They're stuck in their rooms. Their family cannot come see them.
Yeah.
Um, they are depressed. My daughter works at a nursing home, and she had a patient who fell out of her wheelchair and struck her head, and they were not allowed to call for an ambulance because of COVID. And this lady died because she had to wait almost 3 hours before the owners of the nursing home came in and approved to call her an ambulance. And she had a brain bleed, and she needed attention, and she died because of COVID, literally. Like, she could have probably been saved, but she sat and bled for hours before she got any attention. So where's the benefit, to closing everything down and not returning to normal when people are going to die from other things? Is that making any sense? Like, it
Yeah,
really upset me.
basically what you're saying is that woman was a victim of COVID and didn't even have it. And I
Correct.
think that I
So she
think that
should
is
go down as a
happening
COVID death.
over and
Yeah.
over and over again. Right, exactly. Ridiculous.
Yes,
So let me
yes.
ask you ladies this. So moving forward, if you guys had the power to make the decision starting tomorrow, whether it was businesses or restaurants or nightclubs or concerts or school, what would you all do? And I'll start with you, Joy. What would you do tomorrow? And this is based on your experience, based on what you've seen with your own two eyes, and armed with all of the knowledge that you have. How would you proceed? What
I
would your
think
recommendation be?
people need to hear the truth, and they need to see the stats. They need to see the bigger picture. They need to realize the bigger picture, because a lot of people, they're just in their little world, their little bubble, and they don't understand. And that's what upsets me the most about this whole thing, is the manipulation and fear mongering that, it's just been going on, and the ignorance that people have. And ignorance is not a bad thing, it's just ignorance. So to educating people, just basic, the hand washing, just how to prevent the spread of things. When is it important to stay home? I think that's the biggest thing. People, but not in a fearful way, just in this is how you are, just like this is how you take care of your car. This is how you do when it does things maintenance wise. This is what you need to do with this. So not in a manipulative way. You just need to educate the the community about how to really respond to things and not be riddled with fear, because that just makes people act irrationally and nobody makes a good choice. And that's where we are now. I think people are just not making good choices. You see all the crazy, the riots, the things going on, the civil unrest, because people are just, they're upset, they're afraid, they're using whatever excuse they can to just vent and let out their fear and their frustration. And it's caused, I mean, we can talk about the riots and stuff like that. That's a whole nother result of the fear related to COVID. I mean, it's just built up. The country is just ready to explode because nobody knows who to believe, who to trust. So the biggest thing is the truth, that we need to, say we don't know everything, but this is what we do know. We do know that it is not 100% death rate. We do know that people do get better. We do know that there are populations that are at risk, and those people are the ones that we need to protect. Those are the people that need to be more aware. Those are the people that we need to educate the most. But we can't shut down our lives and our families, because at the end of it all, we're going to say, yeah, I died in a bed all by myself with nobody around. That's great. And there were people like that while I was there. They had no family. They had no advocate. They had nobody with them, and they died by themselves. So, I mean, if you're one of those family members who had a family member who died, is that how you wanted them to end breathe their last breath? I mean, it's awful. So I think the truth and education and no fear.
Now, okay, so as far as the practicality of the things that you have just said, Joy, would you, starting tomorrow, just say, look, America's reopened. Everyone use common sense. Everyone stay home if you're sick. But is that basically what you're telling me, that based on what you've seen with your own two eyes, it makes more sense to open back up than to stay completely closed down?
Yeah, and if you're afraid, stay home. If you still feel the need to do what you need to do, because if you're a chemo patient, or if you're someone who's got an autoimmune disease and you're taking Humira, or you're taking Plaquenil or whatever, by all means, please wear your mask, protect yourself. I had my child who's in the NICU. He was respiratory compromised when he came home. He was on oxygen. He was on a heart monitor. Did we take him out and prance him around like a newborn baby? No, we didn't. We had to protect him. Did he have to have RSV vaccine, which is a really expensive vaccine? Yes, he did. Why? Because we were going to protect him. There are things that we did. We didn't allow people to come in our house that were sick, because it was our job as his parents to protect his weakened body. So as a family unit, if you've got weakened family members who fit the criteria for someone who could possibly, if they were to contract COVID, or if they were to contract the flu, or anything like that, and they're at risk for a poor prognosis, protect them. Use your common sense. I mean, that's the thing, is let people be free people and make their choices, but they have to make educated choices. So if you're just spouting, manipulative fear tactics, I mean, there's nothing for people to be educated with, except for just to stay in a hole and be afraid. So, yes.
So Gina, to you, same question. You are now the leader of America. What would you do? Would you flip the switch and tell everybody, hey, let's go back and let's just get through this thing? Would you keep everybody locked down until there was a viable vaccine? Well, what would you do? What do you think?
Well,
and this is based on your professional opinion. What makes the most sense moving forward?
Well, I think everyone needs to go back to work. We need to open back up. And it's just like Joy said, you use common sense. If you've got these autoimmune disease, asthma, obviously diabetes and hypertension, protect yourself. Be smart. But closing down the country is not the answer at all. I totally don't agree with that.
So
School needs to be back. You need to return to the classroom.
we have two professionals that have been basically in the eye of the storm, that have seen the worst of it, that based on your all's professional opinion, you think that there is no downside to flipping the switch and everybody going back to work. Obviously, I think we all agree that cases are going to increase, but that's going to be the situation, whether it's the flu or COVID or anything. I think that is something that we just have to accept as a reality of life. This thing has been hijacked, politicized, and turned into something to create fear and division, in my estimation. And I'm assuming that you guys feel the same way based on the conversation that we have had here today. I really appreciate you guys being here. I really appreciate you guys sharing with us what your experience was, because you have firsthand knowledge of something that I myself do not, and many of the people that are watching tonight do not have. All they've done is seen Facebook videos or YouTube videos or watched what the news has put out there, where you guys see it with your own two eyes. So one final question for each of you. So Gina, I'm gonna start with you. Of all of the reporting that has come out surrounding this, what is the one thing that was the most unbelievable, that when you heard that on the news, you scratched your head and said, oh my God, that is so not true at all? What would that be? What would be the main one? And that'll give Joy a second to think about her answer.
News,
anything, just anything that the media has put out there about this, that you scratched your head and said, holy cow, that is just not true.
oh my gosh, there's so many little things, but more I found the gosh, I don't even know where to start. The lady that came out and said that people were being killed, that nurses were not taking care of patients, that they were not receiving care. That was the most for me.
Did we,
I feel like
did
maybe
we
that happened somewhere else. Do you know what I'm talking about? Uh, are you familiar
repeat
with
that
that?
again? We lost you for a second there. What was that
Oh,
again?
sorry. That the thing that was the craziest thing I heard on the news or in the media was the person that came out saying that the patients in New York were not being taken care of, that they were letting them die, they were not giving them, providing them with care. There were so many things in that really, really upset me. I worked really hard. The doctors, the nurse practitioners, the PAs, we worked so hard to take care of people and still provided a great deal of compassion and love for people. Um, People were taken care of in New York. There were just so many things working against us there that there were a lot of people dying. That was inevitable. That was just inevitable. But people saying that we were killing people. I don't know. Are you familiar with that? Do you know what I'm talking about?
It's your perspective. Like I said, I mean, that's why I asked you that question, what it was that disturbed you the most. So Joy, same question to you. What about this situation, either personally or misreported fake news or real news, what has disturbed you the most that people might have believed or are believing?
I try to stay away from the news a lot just because it infuriates me. But I think the biggest thing that I see is that when the way that it's constantly promoted, like when they say positive tests, the increase in positive tests, and it's every day, every day, every day. It's misrepresented in the sense that people don't understand. They're banking on the ignorance of the populace, not understanding that positive test doesn't mean death sentence. Positive test doesn't mean that you were hospitalized. Positive test doesn't mean that you even have symptoms, especially right now. Positive test now just means that I had to go get a test before I could go back to work, or I was forced to go get a test because this. So that misrepresentation of the positive test going, because now they can't tout that it's death rates increasing now. It's got to focus on the positive test. And I think the other thing that was a little frustrating was that when the riots started getting really bad and you didn't hear much about COVID with the riots, and then the riots, when they started getting really bad, they quit focusing on the riots and started focusing on the positive tests. It's just that manipulative play with people's emotions, and just banking on the fact that people just believe what the news is telling them. That frustrates me, because it's just a misrepresentation of what's really going on at the expense of people's ignorance. And that's what really bothers me, because you're taking advantage of people. And that's probably the most frustrating thing about this whole thing, is taking advantage of people's ignorance. That angers me, especially when you can just pull the data and look and extrapolate your own data and go, that doesn't make sense. I mean, just common sense. That doesn't add up. And so that's where I get the most angry.
Well, I lied to you, because I do have another. You made me think of something else, and Gina, you touched on this earlier. What is the reliability of these tests? How can we trust the test? Because I've heard stories of people, testing an apple and it coming back positive. Gina had mentioned that they were testing a placenta that was positive when the mother was negative. What is the reliability of this stuff? Can we trust it?
I think it was like
what?
The sensitivities. Like, I don't know what y'all are using, but like we're using that Diathrix and the Sophia, and I think it's like a 80-something% sensitivity. So there is a 15 to 20% you could have a false positive, false negative. So there is and of course then you got to consider if the person actually implementing the test is doing it appropriately. If the patient actually lets you do it appropriately. So, I mean, you got some patients that yank that thing right out of your hand and there's nothing you can do, and that's just what you got. So there's a lot of variables to taking a correct
But
test.
That's how a viral test is to start with. They're not all 100% accurate. A viral swab is not ever 100%.
And so, and that's another thing. Like I said, there's so many variables, there's so many unknowns, there's so many things that we can't actually be 100% positive about how everything is going and the data. All I can say is the large picture, the large data that they are reporting, it doesn't add up. And that's the thing, is people have to see the big picture.
So based on your all's experience with the reliability of these tests, are they reliable enough to dictate public policy that affects everybody? Or
No.
is that a mistake to utilize tests that are reliable or unreliable to affect everyday lives of individuals? Would you trust that to make public policy?
The statistics, you can't. The statistics that are on internet that people can look at are not enough to dictate public policy. I mean, you're dealing with billions of people. I mean, because when you dictate this public policy, it's not just going to be the United States. It's not just going to be Europe. It's not just going to be Asia. It's going to be worldwide. I mean, you're going to give them an inch, they're going to take a mile. They're going to bombard us. I mean, because this is going to be set precedents, and that's why people don't get it. If you don't pay attention to politics, this sets precedents for everything else that's going to come down the pipeline, and pretty soon they're going to mandate the vaccines, and that's unheard of. I mean, we're a free country. To mandate vaccines, I believe in vaccines, but I am not going to go against someone who doesn't believe in vaccines, because that's their freedom. That's fine with me. I am not going to say you have to get one, because I have to protect your freedom to choose, just like I have to protect mine. I don't think there's anything right or wrong about taking a vaccine or not taking a vaccine. I just choose to I believe in the science of a vaccine, but I do not believe in mandating it, because then you're overstepping people's freedom of choosing what they want to do to their own bodies. It's a slippery slope.
I have something to add too, that in questioning the validity of the statistics. So every time someone has a positive test, that is counted as a positive test. But let's just say you were positive and you
We lost Gina again.
that's another positive test. Oh, did I cut out?
You
I'm so
you
sorry.
cut out for us on a second there. We've got your audio, but we don't have your beautiful face.
Oh, so I'm sorry. My kids keep calling. Okay, so like if you test positive, they turn around and do a repeat test in a week or two, and then if it's still positive, they'll repeat it again, and they'll repeat it continuously until you have a negative test. So, so at minimum, you're going to have 2 positive tests there. Um, Someone in the hospital is going to have one every other day, so they could have 10 positive tests. Are these being tracked as individual positives, or I mean, I'm just questioning. When I'm questioning the validity of their numbers, I'm saying, how did you get to this number? Are you counting every single positive test as a new positive test? Are they breaking it down into repeat tests? Um, and like my daughter, I told you, works in a nursing home. She also has another job. She works at a doctor's office, and they have a COVID team. And you line up out in front of their office, and they're testing you, and they have a three minute turnaround on the test. And Monday they did, I think, 300 people. Okay, so none of them were actually sick. They just wanted to know, do I have it? Because they're so afraid that you sniffle and it's like, oh my God, do I have COVID? Um, you know, how are they tracking tests? Besides the test not being 100% accurate, how are they differentiating between an initial positive and the 10 they did after that? Does that make sense?
Yeah. So you're saying that potentially the tests could be skewed. One person could have 10 tests.
Correct.
And so if you've got 10 people each tested positive, that would be 10 cases. But if each tested positive 10 times, then
That's
you've got
100.
100 cases.
Right.
And so that would be a way that they could easily manipulate the numbers
Exactly.
if they needed to continue the fear. I
Right.
think that's what you're saying.
That's exactly right.
And I don't know that people's health is really the thing that we need to be using to manipulate them, because when people are afraid of dying, they'll do a lot of things.
Mm-hmm.
They will comply with what you tell them to do. So, well, wow. Ladies, we've gone 2 hours. I apologize. I didn't mean to take you that long, but we had a lot of information. I want to thank all of the viewers that stuck with us as well. There'll be thousands and thousands more that will watch this because it will be archived and repeated. I hope that you all will return and talk with us again. Is that something that I could get Joy and Gina to both agree to?
Sure.
Would you guys be willing to come back and join us for something like that?
I would.
Well, it has certainly been my distinct pleasure discussing this with you. And I know that everybody here that has been commenting and interacting, I know that they've enjoyed it as well. Thank you guys for tuning in and hanging with us. Again, I am Cam, stupid cover band singer, and this has been Outside My Lane, episode 2, and we will see you guys again real soon.